Hello, my name is Dr. Derek Snook and I'm here to talk about arthritis awareness. Arthritis, as the name implies, is inflammation of the joints. Itis meaning inflammation and arthur meaning the joint. The spine is what I'm going to confine most of my talks about. The spine has some unique properties compared to other parts of the body. So any of the joints in our bodies can develop arthritis, but the spine has some unique properties and they focus around two unique things. One is that the spine has the discs, and the discs are not exactly an arthroidal joint, but they are a tissue that can break down, and it is a form of arthritis. The other unique part about the spine is that each of these discs works in concert with a joint or two joints in the back of the spine called the facet joints. The facet joints are very classical joints, just like other joints in our body, such as our fingers and knees and hips. And those, as they get arthritic, can start to become larger, and the discs can start to also degrade. Sometimes arthritis starts in the disc, but eventually, if one part of the tripod between the discs and the joints is affected, then all three of those things can be affected. In addition, there are multiple segments to the spine with each of those three joints that makes the spine very unique. In terms of arthritis, there are two main causes. One is an autoimmune cause, we believe, often called rheumatoid arthritis, and those patients have a genetic susceptibility where their immune system seems to want to attack their joints. The other type of arthritis, which is actually more common, is more wear and tear arthritis. It implies that with wear and tear, it comes with timing as well as load on the joints. And so those who have heavy physical jobs may be more prone to have arthritis, particularly the wear and tear type. In addition, carrying extra weight can also be a risk factor. But genetics, once again, plays an important role. So just as in heart disease, where if your parents have heart disease, you can do all the right things, live a healthy life, exercise regularly, control your risk factors for heart disease, but you can still develop heart disease. The same goes for arthritis of the spine. Symptoms of arthritis in the spine may manifest themselves as stiffness, as the name somewhat implies, as well as pain. That pain can be sometimes a very non-specific ache. Much like when we have a belly ache, it's difficult for us to determine where that specific ache is coming from, whether it may be the stomach, the small intestine, the large intestine, etc. It's also very difficult in the spine, just in terms of distribution of the pain, to determine exactly where that pain is coming from in terms of a specific joint segment of the spine. Stiffness and pain obviously can be a significant quality of life issue, and so that also leads to other potential problems with the spine. The arthritis, as we get older and have advancement of our disease process, and from a pathoanatomy standpoint, allows these joints to get larger and also allows for the disc to start to bulge as we get older. The combination of those things results in a narrowing often of the spinal canal. That can ultimately cause pressure on the nerves, and that pressure can eventually cause pain to shoot down into the legs from the lumbar spine. And in the cervical spine, those instances can cause pressure on the nerves that work our arms, and so that can cause pain as well as weakness and numbness in the arms. As far as diagnosis goes, diagnosis is largely a function of three important things: a history and physical done by your physician, a physical examination, and then imaging studies. Imaging studies may be something as simple as x-rays, or something more complicated and specific, such as a CT scan or MRI scan. We use those tools, the history, the physical, and the imaging studies, to determine our treatment. Initial treatment for arthritis often involves using medicines that counteract the inflammation. So what we call non-steroidal anti-inflammatory drugs are a very common first-line treatment. Medicines such as Advil and Aleve can be helpful. Things such as ice and heat can be helpful. Modalities like over-the-counter creams can be helpful. Physical modalities as well can be helpful, and that is why we often prescribe physical therapy. Chiropractic manipulation can also be an important adjunct to treatment of arthritis. Stretching, regular physical exercise is good in terms of keeping your mobility as well as keeping your strength and functional abilities. More specific treatments depend also upon your symptoms. If you have significant pressure on the nerves and pain radiating into the arms or legs, that is when we may be even doing things that are more specific and more sophisticated, such as injections. And there's a couple of different types of injections. One type is designed to treat inflammation within the nerves, what we would call an epidural steroid injection. The other is designed to try and block the pain that's mediated from the arthritis, oftentimes in these joints. You'll hear that often referred to as a nerve block or a nerve burn or nerve ablation. Those can be helpful things in the treatment of arthritis of the spine. When all else fails, occasionally surgery may be necessary, and surgery is dependent upon the pathoanatomy that is present. Some people are able to have what is called a decompression, or more commonly a laminectomy, to take the pressure away from the nerves. But there are those who also have such severe arthritis that the spine becomes slightly unstable. That may manifest as a spondylolisthesis or a scoliosis and deformity, and in those cases we may have to not only do a decompression or laminectomy, but may also have to do a fusion operation.